Hi everyone. Today we are going to see about internal resorption. So internal resorption is defined as it's an idiopathic, slow or fast progressive resorptive process occurring in dentin of pulp chamber or in the root canal of the teeth. So the cause will be mostly of trauma. Symptoms will be mostly asymptomatic and there will be a manifestation of a reddish area on the coronal portion of the tooth surface, which is also called pink spot. This reddish area represents the granulation tissue through the resorbed area of the crown. So, mostly the diagnosis may affect either the crown part or the root part or the entire tooth. It may be extensive or both. It is a slow, progressive, intermittent process extending over 1 to 2 years. It may develop rapidly and may perforate the tooth within a matter of months. So, usually, internal resorption is diagnosed during a routine radiographic examination. The appearance of a pink spot occurs late in the resorptive process when the integrity of the crown has been compromised. So, mostly the differential diagnosis will be when internal resorption progresses into the periodontal space, perforation of the root will be occurring. So it is difficult to differentiate from external resorption or an internal resorption. So the resorptive defect is more extensive in the pulpal wall than on the root surface. So while moving on with the histopathology feature, internal resorption is a result of osteoclastic activity. So it is characterized by lacuna, which may be filled by osteoid tissue in an attempt to repair. The presence of a granulation tissue occurs for profuse bleeding when the pulp is removed. There will be multinucleated giant cells or dentinoclast. The pulp is chronically inflamed. Metaplasia of the pulp will be occurring, which is transformation of one another type of tissue, that is bone, cementum, or sometime occurs. So the treatment will be extirpation of the pulp. Stops the internal resorption process, and in many patients the condition progresses unobserved because it is painless until the root is perforated. So in this case, mineral trioxide aggregate cement is recommended to repair the defect. So while moving on with the prognosis is best before the perforation of the root or crown. So thank you.